told you earlier about an increase in monkeypox cases in New York City, at least 19 now. There are a lot of questions about transmission, especially as people have COVID top of mind. And joining us to sort it all out is Dr. Jay Varma, an expert on diseases and director of pandemic prevention and response at Weill Cornell. And Dr. Varma, thanks so much for joining us today. Let's talk about how this is transmitted.
Yeah, the most common way that this disease is transmitted is direct skin-to-skin contact. So it starts with a person who has a rash, and then they make skin contact with somebody else's skin. Now, there are other ways that it can be transmitted. Scientists are still learning. There is the possibility that it can be spread through the air, but everything that we know right now shows that if it does spread through the air, it's only over a very close range. In other words, you're not going to get it from somebody who's far away from you. That's the current understanding right now. So it's really all about skin-to-skin contact.
Skin to skin. Okay, well, let's dive a little bit more into that. We know that anyone at this case can get or spread monkeypox, but the cases in New York City have been among men. I know ages 27 to 50 in the gay community. The city at the same time is ramping up its messaging in Pride Month. What would you like to emphasize here?
You know, I really want to emphasize first and foremost that this is not a, gay disease. For a number of reasons, this infection, started in Europe and started spreading among men, gay, bi, and men who have sex with men. So right now, that is the social network that we're most concerned about. So I want to emphasize, first of all, anybody can get this disease. But at the same time, right now, the group that is at highest risk are men who are having sex with men. And the most important thing that those men can do is to make sure anytime they're going out for any type of social activity, particularly if it might involve sex, do a quick check of your groin and even of your butt area. You may need somebody to help you to do that to make sure you don't have a rash, because this rash can be easy to miss unless you actually look for it at the beginning.
Okay, that is really good information. So, is there anything, a vaccine or something for monkeypox? Anything that we should know about?
Yeah, I want to emphasize a couple of important points for people. First of all, there is some good news, which is that so far this disease has not caused anybody to get severely ill. Now, we know this can be a severe illness, but so far, everybody in the United States that's been reported has done well with this, number one. Number two is there is a vaccine that's available. Now, that vaccine was originally developed for smallpox, and there is one for monkeypox. So eventually, this vaccine has become more widely available and used, but it's going to be prioritized for people at highest risk. And I would think the third thing I really want to emphasize is that public health people can contain this, but the real key is for people who are sexually active with other men to just be on the alert and just do a quick skin check and make sure you're healthy before you go out and enjoy these Pride events.
I think that is really smart. You need to have the candid conversation, and as you said, do a scan, make sure everything's okay. Okay. Well,
absolutely.
Yeah. Dr. Varma, thank you so much for joining us and giving us a little bit of more clarity about monkeypox. We appreciate it.